So you want to know what HRV is, or heart rate variability? Well, it is the variation in the time between the two beats. So you know what heart rate is. So say you have 60 beats in a minute, you think the beats are equally paced, 1 beat per second, but it's not exactly like that. And this is where heart rate variability comes in, because it is the time between the heartbeats. Now, this is measured through a wearable such as a Whoop, an Oura Ring, an Apple Watch. These things give us real-time measurements, but it is best measured at night. And we want to look at it over a spectrum of time, month, week, 6 months. So what this heart rate variability is telling us is how well is our nervous system regulating itself? How well are we going to rest and recover? And this HRV is the interaction of the sympathetic, which is like the fight and flight, go, 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 and the parasympathetic nervous system, which this is all under the umbrella of the autonomic nervous system. So this division of the autonomic nervous system, your parasympathetic and sympathetic, is cool because your nervous system is regulating your heart. And it does this through the cervicothoracic ganglion and the vagus nerve. Your vagus nerve is running like a little gypsy through your chest, under your sternum, which is something I'm talking about with women for our gut-brain axis, because it is bi-directional. Your vagus nerve is exceptionally important, ladies. I need you to learn how to regulate your nervous system for later in life with perimenopause, menopause, hot flashes. But I carry on. HRV is one of the approaches by which the state of the neurocardiac physiology can be assessed. So the nervous system and the cardiac are best friends. And things that you do that make your heart rate variability bad: heavy cigarette smoking has been associated negatively with autonomic nervous system function, and it is suggested that cardiac vagal regulation is reduced by smoking, which may be considered as one of the pathophysiological aspects of smoking. So smoking hurts your heart because it's affecting, it's so not good. You also go into menopause a year earlier, 1 to 2 years earlier, if you smoke. But your heart rate variability could also be low if you are anxious and depressed, but this isn't surprising to you, because if you're anxious and depressed, your nervous system's not regulated, and your heart rate variability is kind of a show. It's a tell of how well are you regulating your heart rate variability, because you're not. And so things that you can do to improve your heart rate variability other than quit smoking, well, yoga, because in yoga modalities, the body and mind practice are involved, which the aim is to maintain a balance between the body and mind, because we forgot how to rest and how to be present and how to breathe. And this is why yoga is exceptionally important for women to learn how to regulate our nervous system. Because also during perimenopause, these hormonal changes will tank our heart rate variability. And I need you to know that there will come a time where you could be doing all the right things and your heart rate variability keeps going down, 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 down. And you're like, this doesn't make sense. Oh yeah, it's your hormones. Because your hormones kind of play a role in your heart rate variability. And they also play a role in your ability to make muscle mass. Remember that? And I think you can see the picture happening, right? You can see it.